Well, good afternoon, everyone. Thank you so much for joining us for the Parent and Family Services first presentation for the summer. We're very excited that you are here to join us and learn a little bit more about the health and immunization and insurance requirements that we have for our students starting here at UAB. My name is Meredith Call, and I serve as the Director for Parent and Family Services here at UAB. And I have invited the two experts in this area related to health insurance and immunization. And that is Carol Griggs, our Administrative Director from Student Health Services, and Dr. Michael Faircloth, also from Student Health Services, to walk through everything related to these requirements that we have here at UAB. However, before we get them to start to actually talk through everything, what I'd like to do is take just a couple of minutes for those of you that are joining us through Zoom and show you how to use the Zoom product and how to share or provide any questions or things that you may have. And then we'll get started with the actual information. So first things first, what you need to know as a family member here or utilizing the system, if I can, there we go. If I can get my technology to work with me like I need it to, is going to be a couple of things. If you are having any challenges with the audio of the presentation or anything, if you click down at the bottom of the thing, you should see something that says join audio, click to join audio, audio settings, anything like that. When you click that, something should pop up in regards to, it looks like this, allowing you to change the volume settings around anything along those lines. However, if you're still continuing to have problems with this, if you registered online with Zoom, it should have also sent you a phone number where you can call into the webinar and hear us through a phone audio versus through your computer. The next thing to know is if when you have questions or concerns or things that you need to know about and you want us to ask you, that information will be highlighted through this function right down here on the bottom. We will be utilizing the Q&A function more than anything. So that Q&A piece is this piece right here. So when you click that, you will get a box that's something along those lines that says enter your questions, no open questions, and there's an opportunity there for you to type in your respective question. This is a quick snapshot from a previous webinar that we held, but so this is how you can type in the questions. You just type it in down here. It comes back through to all of us on this side. We will be monitoring these questions the whole way through. The thing that I also want you to notice is if you do see where someone has typed in a question, take a look at that question, because if it is the same one that you already have, there's this little thumbs up icon right there, a like button. If you just hit that like button, what that does is lets us know that there are multiple people that are very interested in that question. It actually pushes that question towards the top of the queue. So if there are multiple questions coming in and on various topics, but there is one question that has a lot of interest from a lot of people, then by hitting that like button, what it does, it pushes it up in that queue for us, so we know that that is a critical question that many, many people have, and we want to make sure that we answer it. So that's a key thing to know. And so the biggest thing, again, how we're going to be answering and communicating with everyone is going to be through that Q&A function if you're using the Zoom platform. If you're using Facebook Live, we're also monitoring the Facebook Live questions, so you can just type your questions into the comments there, and we will make sure to answer those as well. So with all of that being said, I'm going to go ahead and turn it over to Carol and Dr. Faircloth so that they can start to share with you all of the policies and procedures.
Good morning. Thank you for taking the time to participate in this presentation and discussion. As Meredith said, I'm Michael Faircloth, the Medical and Lab Director for Student Health Services, and I'm joined by Carol Griggs, and I'm going to let her tell you about her role.
Yeah, hi, I'm Carol. I am the Administrative Director at Student Health Services, and so often when your students come in and have questions in regards to insurance or anything in regards to our services, I'm typically the person that they would see.
So we thought that we would this morning discuss two of the very important requirements that we have here on the UAB campus, and two requirements that often lead to questions from students and parents as well. We're going to talk about the insurance requirement and what that means, and then briefly cover the immunization requirements, and certainly leave time for your questions. We'll be happy to entertain those at the end. So again, thank you for taking the time to do this.
Yeah, so we're going to jump right into the insurance, and we're going to talk about insurance and insurance waivers. And then finally, Dr. Faircloth is going to wrap us up with the immunization policy. And so here at UAB, about 2 years ago, UAB adopted a new policy that requires all eligible students to have major medical insurance coverage. Now, an eligible student within our system is a student that is an undergraduate student registered for 9+ hours, a graduate student that is in a program that requires that they have coverage. If they are an international student or a student that's enrolled in a clinical program, they're going to be required to have insurance as well. And so you might wonder, why did UAB adopt this policy a few years ago? Well, there are two major reasons. One is that we know from national data that students who are, or people in general actually, who are uninsured are less likely to seek medical care. And so when we think about the age brackets that we're dealing with in higher education, about 18 to 25, according to national data collected in Gallup, about 15% of that population is uninsured. And then if you look at that next age bracket, about 26 to 34, it's about 18.5% of them are uninsured. And so here at UAB, we adopted this policy so that we can ensure that the students actually have medical care or insurance, so they have access to medical care, because they're here on a campus with students from all over the world. And we know that they're going to be exposed to germs, and they're going to get colds, and there's a good chance they're going to get sick while they're a student here. And we want to ensure that they have access to care. Now, the second reason that we adopted this policy is just because of the sheer cost of care. Medical care in the United States of America is very expensive. And another research poll done a few years ago in Public Agenda, out of about 600 adults, all of them that were surveyed, 69% of the ones that did not complete college actually reported that having health insurance would have helped them to complete their academics or graduate from that program. And so we know that this is something that's beneficial not only for a student's health, but it's also beneficial for their academics. And so UAB adopted this policy, and we've created a very streamlined process here for students with regards to insurance. And so for the insurance policy, or for the insurance process itself, UAB actually offers a student health insurance plan, which we often refer to as SHIP. And since we have this mandatory requirement, we've been able to develop a process that streamlines enrollment. And so all students that are eligible are actually automatically enrolled into this policy unless they submit an insurance waiver, which we're going to talk about that in a second. And so students that are eligible are automatically enrolled, but if they have their own insurance coverage, they can submit an insurance waiver. Now, that coverage has to be ACA compliant, that's the Affordable Care Act. And it also has to meet the university's requirement, which both of those are actually quite close. If a student is actually enrolled into the SHIP, this year that policy is provided by United Healthcare. The premium on that policy is $2,140 per year. When students are enrolled in that, they're only charged for the semesters of enrollment. So with that said, if a student is enrolled in the policy in the fall, they're only charged for the coverage in the fall, which is $813. And then when we get to the spring and summer coverage, which spans about 9 months, or 8 months rather, is actually together. And so both of those coverages together for both terms is about $1,327. And so what that means is that in the fall semester, a student will see the premium for the fall semester of $813. And then in the spring semester, they're going to see the charge for both the spring and summer unless they are graduating for the summer and they contact us and tell us that. Or if they have some other extenuating circumstance that, they're going to have another coverage that they're eligible for in the summer, and then we can waive that coverage in the summer. But again, they have to contact our office for us to manage that. The student health insurance plan also has a $250 deductible, a $4,000 maximum out of pocket. It's an 80-20 co-insurance plan for in-network providers. United Healthcare has a national network, and so students can have access to care regardless of where they travel throughout the United States and really the world. And also with the Affordable Care Act and the updates that we received within the insurance market in 2014 and 15, every policy includes certain things for students that are under the age of 19. And so for this particular policy, we do have one comprehensive optometry exam included. And then for students that are 19 or below, we also have dental services available. On this plan, again, with the Affordable Care Act, all plans have to provide psychiatric services, and so that is also included in the student health insurance plan. However, if a student has their own medical coverage, that could be that they are working and they have coverage through their employer, or maybe they're on, mom and dad's plan. As long as that plan is ACA compliant and it meets the university's requirements, they can waive out of the SHIP. And we'll talk through how they can submit a waiver here in a second, but notice those deadlines. This is really important. The premier submission deadline for the insurance waivers is actually July the 1st. That's a couple days away. We really want to encourage students to submit those insurance waivers by that date, because what that does is it prevents a charge from going on their account for the premium for the fall semester. Now, the final deadline for the insurance waivers is actually September the 6th, and so we do accept waivers up to that point. But we really like to not have a charge on their account if they don't need the coverage. It just provides for a cleaner process. And the reason that we put the charge on the account so early, and really the charges won't populate on the accounts until about the last week in July. We put those on the accounts though, so that students can spread the cost of that premium out over the Blazer Flex payment plan, which is a payment plan that incorporates 3 separate payments that total whatever the balance on the account is. And so we put that on so that students can capitalize from that. However, we don't want to put that charge on if they don't need the coverage. And so we strongly encourage them to submit those by July the 1st. If they don't, however, they have until September the 6th. If they submit it after July 1st, we can remove the charge from the account. That's not a problem. And then the remaining balance on the student's account is then divided up into whatever remaining payments they might have on their Blazer Flex, or however they're going to make those payments. So the insurance waiver, if a student wants to submit an insurance waiver, and this information for as far as what's ACA compliant and what's not is actually located on www.healthcare.gov. Where can I read the Affordable Care Act? And you can read a lot of the requirements for plans to be ACA compliant at that location. But for the insurance waivers, the plan has to be ACA compliant. The company has to be insured or licensed to conduct business within the United States of America. The insurance also has to provide coverage for physicians and hospital providers in the state of Alabama. They also have to cover inpatient and outpatient mental health, cover pre-existing conditions. Also, the insurance has to have unlimited coverage per illness and injury, and also be active for all semesters of enrollment. When students submit their insurance waivers, they do that about a month before school starts, and so it's really important that they know that throughout the semester we validate that coverage to ensure that they still have active coverage. And so we want to ensure that they're not submitting short-term policies or anything like that that's going to be canceled at a later date. If it is canceled during the enrollment cycle, then we actually will enroll that student in the student health insurance plan and send them a portal message so that they know that that has occurred. To get to the information that kind of guides them through the insurance waivers and how to submit them, if they go to our website at www.uab.edu/students/health/insurance-waivers, there's actually a tab that is labeled waivers. And if they click on that, they can read about the requirements for the waiver, but then there's a little green hyperlink there to the patient portal. And all waivers are submitted through the patient portal, which is a secure network, and so it's not on a public domain in any way. They're going to log in there, and when they get logged into the patient portal, it's going to ask for their date of birth and their UAB Blazer Strong password. And then once they get into the portal, the tab for the insurance waivers is about the 6th or 7th tab down on the left-hand side. And once they get logged in there, it actually actually will walk them through all of the pertinent information that's needed for the insurance waivers. Now, if they need or even if you as parents want to take a look at the process for that waivers, it's actually on this exact same website on the right-hand side of the page. Again, that's uab.edu/students/health/insurance-waivers. And there's a little guide there that kind of walks you through the insurance waiver process. Once a student goes through that process and submits a waiver, it comes to us in this secure format, and then we actually send all of that data off for third-party verification. And so when we send that data off, it comes back either validated or invalid, and it could be invalid for a lot of reasons. Sometimes it's just typographical errors, and then sometimes it could just be that the coverage, for whatever reason, when we validated it, was not accurate or was not active, or it was just inaccurate information. Maybe they selected the wrong carrier. And so with that, it's very, very, very important that students submit a photocopy of their insurance card. This year, we've actually turned that on as a requirement in the system. So when they submit their insurance waiver, the very last step is to upload a photocopy of that insurance card, both front and back, so that we can fix any of those typographical errors or any other errors that we might notice without having to contact the student. Once we validate the coverage, the insurance, if it's approved, then the students get a thumbs up and there's actually no more steps. They're not enrolled into the student health insurance plan. And when they log into their patient portal, they'll just see an approved status. If it's not approved, when the student logs back into the portal, they will see that the coverage has been declined. And at that point, they need to actually contact our office so that if they want to resubmit their waiver, we can allow them to do that. The portal itself won't allow them to resubmit on their own. They need to contact us because sometimes they really just need to utilize the same information. It might have just not been active. You know, if they submit it today, it's going to be active July 1st, you know, that kind of thing. And so really they just need to contact our office. They can do that through the patient portal. They can contact an insurance coordinator. They can also call our front desk at 205-934-3580 and speak with someone in insurance, and they can help them to navigate that. All right, I know that was a lot of information, but hopefully you're submitting your questions so that Meredith can help us navigate those. We're going to go ahead and move on into immunizations at this point, and I'm going to hand it over to Dr. Michael Faircloth, who is the Medical and Lab Director of Student Health Services.
Thank you. So, as you know, we at Student Health Services are part of a renowned institution and academic medical center that provides world-class education, research, and healthcare. Student Health Services, we demand that same high level of excellence and standards from ourselves, and one of those high standards is the immunization requirement, which we are responsible for. Those requirements are based on evidence-based recommendations from the Center for Disease Control, the Advisory Committee on Immunization Practices, American College Health Association, and the Alabama and Jefferson County Departments of Health. The purpose is to provide a safe and healthy environment for all of our students, our faculty, visitors, patients, and staff. A campus free of infectious disease is a matter of campus safety and frankly is a public health best practice. The only exception that we allow are medical contraindications, because there are some folks that have medical illnesses or taking medicines that preclude taking immunizations, and we're aware of that. Our compliance rate typically runs about 99%, and that 1% would include those folks who cannot take it for some reason. We do have a pre-matriculation requirement, which means that before you begin classes, you're supposed to be compliant. That does not mean that you're finished. It means at that point you're compliant. For instance, you may require 2 varicella vaccines, and the day you start class, you've had one, and it's not time to get the second one yet. It's a month later. So you're compliant. So you don't have to be fully finished and compliant to start classes. We are fully compliant with the CDC and other standards that I mentioned earlier. What we require, there's several sets of requirements. It depends on which population of students you are. The largest population would be undergraduate and graduate domestic students. We also have clinical students and international students. But for the majority of students, and really the common things that all students are required to have are 5 things. 2 MMRs, 1 Tdap, 2 varicella vaccines, a meningitis vaccine if you're under the age of 22, and that's whether or not you reside on campus. It doesn't matter. If you're under 22, you're required to have a meningitis vaccine. And for folks that are born in the United States that are not clinical and not international, we do TB screening, which is simply a questionnaire. And if all the questions are answered no, then you're done and you're compliant. If you answer yes to any of those questions, then you'll require testing, either a skin test or a blood test. For clinical students, they have a couple of extra requirements. They actually require TB testing, again, a TB skin test, which is a 2-part test, or a one-time blood test. And they also require hepatitis vaccination. International students require these same 5, except they also require TB testing instead of a screening questionnaire. We at Student Health have all of these vaccines available. We bill those to insurance. We charge what it costs us. We're not trying to make anything from giving it. We don't have an administration fee. And again, we have ample appointments available on a daily basis where you can get those. You can certainly get those from your local health department, from your local physician, but we'll be glad to provide that service for you.
And we do apologize on this screen. It actually says Clinical International in that bucket, but that's actually just clinical students. I apologize for that typographical error.
Yeah, if you want to view the actual immunization policy that sits in the UAB Immunization Policy Library, there's a link at the bottom of this screen that will take you there, and it's about a 1-page document that sort of outlines what I just talked about in the different populations. It does not talk about the individual requirements like the MMR and varicella and that sort of thing.
Yeah, but if you navigate to our website at uab.edu/students/health, if you click on the immunization tab at the top of the page, that tab will actually take you to both the immunization requirements themselves, depending on if it's just an undergraduate student or clinical student. And then at the very bottom of that page, you'll see this screen that's actually on your screen right now, and that actually will take you to the immunization policy as well.
That's correct. So the other thing I'd like to talk about is we are a state-of-the-art facility. We provide state-of-the-art, full service, full spectrum family medicine, primary care, including women's health, sports medicine. We do minor procedures. We take minor emergencies. We have a mental health nurse practitioner. So we can do pretty much anything. Our goal is to have a student most of their or all of their needs that can be fulfilled within the Student Health Center. If not, then certainly we have many resources right down the hill that can help us out as far as specialist care. But we think that we do take care of greater than 90% of our student needs within the Student Health Center itself.
Yeah, and we're actually located in the heart of the campus. It's directly across from the new freshman res hall, which is where the vast majority of our new students reside. And they can just literally walk over a hill to our facility. And then for all of our other students who might live off campus, they can all schedule appointments in our patient portal. And so they have access to us through multiple modes. And we also have triage services. And so even if they were to log into our patient portal to schedule an appointment and we did not have appointments available, they can always come in and see a triage nurse. We always have someone there standing by, and they can get them to, if they need urgent care, emergent care, or even if it's just something that they might not actually need to see a physician for, we can still manage the vast majority of that in-house. And so we definitely want your students to know that we are there and available. They can reach us through the portal. They can call us, again, at that number, 205-934-3580. And they can also just walk over and visit us if they should need anything. We don't have walk-in appointments, but again, they can see a triage nurse if they need anything. So for nights and weekends, we're not open, but one of us, either a physician or a nurse practitioner, and if it is a nurse practitioner, they're backed up by a physician, we're on call 24/7. So at night and weekends, we're always available, a phone call away. Yep, and that information, again, is located on our website at uab.edu/students/health. When you go to the website, if you're going to look for the on-call provider, you would just select health services or services provided. And once you do, after hour services is one of the tabs on the left-hand side, and you should be able to get that phone number. All they will have to do is call that number. It would be a UAB pager, and they will, or a UAB operator, and they would then page the on-call provider to call your student back. So at this point, that wraps up our presentation, just providing an overview for insurance and waivers and immunizations. And we'd like to open it up for questions. Hopefully you've been submitting those to Meredith.
Well, so again, the best way to utilize the question function or to ask me questions is type it into that Q&A function through if you're utilizing Zoom, or if you're watching us with us live on Facebook, you just submit it through the comment section, and we'll be ready to go to answer some questions. While you're thinking of those or typing those in, I did think of a couple that I wanted to ask both of you so that we can clarify. Just these are things that I thought of. Carol, I know when you were talking about the health insurance requirements, you did mention that you go through and verify health insurance periodically throughout the academic year to ensure that students still have an active policy. Do students so have to resubmit a health insurance waiver every academic year or every academic semester, or is there any type of timeline that they have to do that?
Sure. And so right now we actually, for students that are starting in the fall, they actually only have to submit one insurance waiver for the entire academic year. And so most of them will submit that in the summer, and that lasts them until the following summer. Now for a student that's going to be starting, in the spring, if that's the first semester, of course, they would have to submit one in the spring, but then they would still be required to submit one for the following fall because it's bracketed by academic year.
That makes perfect sense. So again, so you do have to, your student will have to go through and resubmit all of that. When we were talking about the insurance requirements and what they are, I know a lot of students, especially if they're coming from within the state of Alabama, have the pink form, blue form, colored form, blue form, the immunization blue form. Mm-hmm. How do families and students make sure that you all get that information, or any immunization information? Do they bring it to your office? Do they fax it? Do they submit it online? Anything along those lines?
Yeah, actually, I'm going to go back in this presentation for a second so that we can go back to the waiver page. So once a student gets logged into the patient portal, there is actually a tab at the very bottom that says immunizations. And so again, they would use the same secure method, go through the patient portal, click on immunizations, and actually they would upload all of their documents there. Once they upload it, it's actually just going to ask them to save it. And once they save it, it comes to us automatically because it's saved in their portal, but it comes to us to review it. And also for students that are in the state of Alabama, if they, for whatever reason, can't locate that record, they can contact our office. We actually have access to the state's registry. And so we can look up some of that information as well. We like to minimize how much searching you have to do for records. And so that definitely helps. But there are a lot of folks out there that have those records, and honestly, a student can log in from their cell phone and snap a photo of their immunization card and save it on their phone, and it comes right to us in the same way. They can actually do the same thing with their insurance waiver. They can go through the waiver on their phone, and then when they get to the portion where they have to upload a photo, they just open up the camera on their phone, snap a photo of it, and submit it that way. We've made it as user-friendly as possible for the young folks. The older folks still struggle some, self-included. But it's definitely a lot easier for the younger population to manage some of those requirements.
Wonderful. Well, what other additional questions can we help answer from any of our wonderful participants that are joining us today? Are there questions that we have not been able to provide for you that you were specifically looking for in regards to this presentation?
I will make a note too, not specifically on insurance or immunizations, but again, we reiterate that Student Health Services is a fully serviced outpatient primary care clinic. And so we can manage all of your students' medical needs. In the event of a true emergency, of course, we have 2 ERs that are within very close proximity. But again, any questions that your students have or any needs that they might have, they can see us. The great thing about Student Health Services is that our mission and our goal is not just to provide medical care, but it's actually to provide medical education and health literacy. We want your students to grow and to understand more about their own health and their own well-being, but more so that when they leave college, they're better people that understand life and themselves and how to maintain their own health a little bit better. And so definitely if they have just questions about, should I see a doctor, should I not, or, what's in this test and what's not, all that good stuff. Not academic tests. We can't do that, but we can help them if they have any medical questions or anything. So definitely encourage them to come by and see us.
I've got a couple questions that have come in. One is about, and I'm going to apologize, it does say, are the counselors degreed or are they student interns? I think that they also are referencing the medical staff that are in student health services. Are they degreed individuals or these student interns that are coming in?
Is that for health services or counseling or both?
Let's start with student health services. Yes.
Yeah, for student health, they're fully licensed physicians or nurse practitioners and boarded in our specialties, yes.
Yes, we do not have interns or any of that. We do have residents on site every once in a while with the School of Medicine, but they're not considered students. They've actually already completed medical school. And so we do not have students. We have licensed professionals.
And they're there for training purposes. Everyone's still seen by one of our physicians or nurse practitioners.
Mm-hmm. And then from an additional question is that their family lives in Alabama. And the question, I'm just going to read it per se. It says, my family lives in Alabama. Should our family physician have access to their daughter's immunization records even if they were immunized elsewhere? So if they moved to Alabama post their student receiving their immunizations, should their physician have those records?
If they requested those records when the care was initiated, but if not, then they very well might not have access to those records.
And to access those records, you would have to go back to the original physician from which you received them. Or you can also contact that particular state's health department. They might have that in whatever their state registry is.
Wonderful, thank you. I think those are the only couple of questions that I've seen come in at this point in time. I do want to say that first and foremost, I want to thank both Carol and Dr. Faircloth for coming in and sharing this information with you. If you are wanting to go back and reference this information at any point in time, this is going to be posted on the Parent and Family Services website, which is uab.edu/families. It will be posted in probably about a week. It will be fully up there, but that way you can review it at any point in time if you need some walkthroughs on how to use that system, anything along those lines. And then also the Office of Parent and Family Services is always here for our family members. So you please feel free to reach out and ask us any questions that we can. I have a great and easy working relationship with individuals all across campus, but Carol and Dr. Faircloth very much particularly, I'm very able to get a hold and ask them quick questions when need be, and they're very quick to respond. So know that Parent and Family Services is here to help you in any way, shape, and form that we can to make sure that you and your student are off to a successful start and have a successful and productive academic year here at UAB. But with that, I want to say thank you so much for joining us today. We are very excited that you are interested and engaged in your students' experience, and we look forward to chatting with you soon. Know that there are some additional webinars coming up in the month of July. Make sure you check out the website www.uab.edu/families. That is your page, and all the additional webinars that we have, including one on public safety, fraternity and sorority life, financial aid and scholarships, and housing and dining. Those are all some of the upcoming webinars we have in the next couple of months. So we have plenty of opportunities for you to get engaged and connected to ensure that your student starts off on the right foot. And I hope you all have a wonderful rest of your day. Have a great day.
Thank you.
Thanks.